The Human Canary, Video 12, The Myth of Homeopathy. The founder of homeopathy was Samuel Hahnemann, born in Meissen, Germany in 1755, and the son of a porcelain painter. He was noted for being of sickly disposition, but intellectually he was considered very intelligent. When he was 20 years of age, he entered the University of Leipzig to study medicine, but left a year later in 1776, departing to Vienna, centre of the Habsburg Empire and the cultural centre of Europe. He obtained a place at the Brothers of Mercy Hospital in Leopoldstadt, where he met Baron Samuel von Brukenthal, who gave Hahnemann an appointment as his librarian. He studied hard for a few years before leaving the service of Brukenthal to complete his medical studies at the University of Erlangen in Bavaria. In 1779, at the age of 24, Hahnemann was awarded the degree of Doctor of Medicine. After receiving his qualification, Hahnemann married a pharmacist's daughter from Dessau, who bore him 9 children during their marriage, and was his constant companion. From 1782 to 1805, Hahnemann and his growing family appeared to lead a nomadic existence, relocating some 20 times during the period. Despite the extensive travel his lifestyle demanded, he wrote some original articles on chemistry, hygiene, and various health issues, managed an insane asylum for a year, and was appointed the Medical Officer of Health for Dresden. In 1796, commonly agreed to be the establishment date for homeopathic medicine, Hahnemann published an article in the Journal of Practical Medicine in which he delineated 3 methods of healing: prevention, by removing the cause of the disease; cloaking the pain, healing by opposites, sometimes called palliative treatment; and the prescribing of medicines that cause similar symptoms in healthy individuals. Homeopathic treatment never really became known as an alternative treatment regime until 1812, when the Napoleonic War came to Leipzig, where Hahnemann had just commenced teaching homeopathy at the University of Leipzig. The war brought refugees, starvation, and scores of thousands, some 80,000, wounded. In 1914, Hahnemann reported he had treated 180 patients suffering from typhus, of which only 2 had passed away. This sounds quite remarkable, but is it? Typhus is caused by 2 types of bacteria: Rickettsia typhi, or Rickettsia plausici. Rickettsia typhi causes endemic or murine typhus, for which the mortality rate in untreated cases is only around 1 or 2%. Murine typhus is often seen during the summer and fall in the southern United States, mainly California and Texas, and is rarely deadly. For those affected with Rickettsia plausici, the untreated mortality rate is up to 60%. Especially at risk are those over 60 years of age. If Hahnemann's patients were afflicted with Rickettsia typhi, his intervention may not have any effect whatsoever on the mortality rate. After the defeat of Napoleon in 1815, Hahnemann opened a private medical practice while continuing to teach at Leipzig University. He relocated to Cothen in 1821 after losing a court case filed by various physicians and chemists, which prevented him from dispensing his own medicines, which he successfully appealed against in Dresden, and continued work on Organen der Rational Heilkunde, Organen of the Art of Healing, a multi-volume work which laid out his beliefs and principles of homeopathy, The name of the work underwent slight changes over the years as editions were printed. According to various sources, Hahnemann was translating a treatise on materia medica by the Scottish physician William Cullen when he read the drug cinchona, a bitter astringent derived from the bark of the cinchona tree, was effective in treating malarial symptoms. Hahnemann started to ingest the drug, discovered it produced malaria-like symptoms in a healthy human. In a leap of faith, which many say lacked the underpinnings of logic, he postulated the first principle of homeopathy: that which can produce a set of symptoms in a healthy individual can treat a sick individual who is manifesting a similar set of symptoms. In other words, like cures like. Borrowing from the Greek language, he labelled the treatment homeopathy, homos meaning same, and pathos meaning suffering. We now know that cinchona bark contains the alkaloid quinine, which directly interferes with the reproductive cycle of the malaria parasite in the blood. The method of action is absolutely unrelated to Hahnemann's ideas. Hahnemann then conceived the idea of using people as guinea pigs and proceeded to test the effects of various substances when they were ingested by humans. Because of his belief that substances were too strong when tested on a like cures like basis and aggravated the symptoms displayed by patients, he recommended dilution of the substance. He believed dilution would preserve the substance's therapeutic effect and remove the harmful effects, a process which potentiated the spirit-like medicinal powers of the crude substances. As a consequence of this belief, he developed a stepped dilution protocol which involved, in example, diluting the substance to a 1 in 10 mixture, which he termed 1C, and vigorously shaking it. Then the container is emptied and refilled. The second dilution is called 2C, and the dilution factor is assumed to be 1 in 100. At the commonly sold homeopathic dose of 6C, the dilution is 1 to 100 to the power of 6, or 1 to 10 to the power of 12, which is 1 part in a trillion. Some homeopathic medicines are sold at 30C. The fluid is often used to damp a ball of sugar, which is then sold as a cure for the ailment. This then is the cornerstone of homeopathy, the principle that water can maintain the memory of substances that have touched it. It can be seen that any ingredient in homeopathy is diluted down to parts per billion and relies on the fallacy that water remembers. If this was the case, water would also remember every contaminant it had contacted along the way. The fact that homeopathy is still widely practiced may be seen by many as a testament to the gullibility of patients rather than the efficacy of the treatment. In 2014, the British National Health and Medical Research Council concluded that homeopathy is ineffective, recommending against the practice receiving any further NHS funding. In Belgium, the exercise of homeopathy is, since May 12, 2014, reserved by law to only doctors, dentists and midwives. In March 2015, the Australian National Health and Medical Research Council, the NHMRC, after a comprehensive review of research on homeopathy, concluded there's no reliable evidence which demonstrates its effectiveness in treating health conditions. The NHMRC is Australia's premier organisation for supporting health and medical research and is well respected for funding the best research. The NHMRC approached the review diligently by reviewing information supplied by homeopathic interest groups and the public, by reviewing published systematic reviews, by consideration of clinical practice guidelines and the government reports on homeopathy published in other countries. In total, 57 systemic reviews were identified that contained 176 individual studies. Studies were only considered by NHMRC if they compared a group of people who were given homeopathic treatment with a similar group of people who were not given homeopathic treatment. Evidence assessment used commonly and widely accepted assessment methods, which held that for a treatment to be effective, it must result in meaningful health improvements in the patient's health. It cannot be explained by the placebo effect that health improvements were not due to chance, and any health improvements must be a consistent factor in several studies. The NHMRC concluded that there are no health conditions for which there is reliable evidence that homeopathy is effective, that homeopathy should not be used to treat health conditions that are chronic, serious, or could become serious, that people who choose homeopathy may put their health at risk if they reject or delay treatments which are medically approved. Despite the overwhelming evidence against homeopathy as a curative practice, many countries still allow it, and the industry is conservatively estimated to have an annual turnover of more than 100 billion US dollars. Almost every chemist shop and chain in England, e.g. Boots, and in America, CVS, the second largest chain of pharmacies in the US, and many others in the EU stock common homeopathic medicines, which are often regarded by the owner as providing a good income stream. As an aside, and as an historical footnote, which may be interesting to some, the first person and the first homeopath to be captured with the aid of wireless telegraphy was Dr. Hawley Harvey Crippen. He was an American homeopath, ear and eye specialist, and medical dispenser. He was hanged in Pentonville Prison for the murder of his wife Cora Henrietta Crippen on November 23, 1910. Please hit the subscribe button if you want to learn more about the myths surrounding medicine. It's the little image of a Neanderthal on the bottom right of your screen. Also, please indicate whether you like or dislike this video. Thank you.